Welcome back to Cancer Out Loud, Cancer Care's podcast. My name is Daniel LaPook, and I'm an oncology social worker at Cancer Care. I am your host for today. I'm thrilled to be joined by Fernando Palacios, who I had the extreme honor and pleasure of working with for individual counseling over this last year. Fernando, welcome. Thank you for joining and for sharing your story with us today.
Sure. Thank you for having me, Daniel. It's a pleasure to be here today.
So to get us started, do you mind just talking a bit about yourself, your background, and what your life was like prior to receiving a diagnosis?
Sure, absolutely. To make a long story short, I've been in medicine for about 16 years with different, roles within medicine. Most recently, I worked as a registered nurse, and I have a background in oncology as well. I'm currently a nurse manager. And before my nursing journey, I was also a professional dancer. Pretty much sums up everything.
And can you tell us a bit about the experience of then receiving your diagnosis and what led up to that and what that moment was like?
Sure. Well, it started very vaguely, I'd like to say maybe 6 years ago or so, where I started to notice certain symptoms that were a bit alarming, but were kind of put on the back burner. So things such as itchy skin, chest pain. I did follow up with multiple providers, different specialists. And at that time, unfortunately, there weren't any indications of cancer, of a cancer diagnosis. So it was kind of left in the back burner. And most recently, about a year ago from today, I developed some sort of discomfort to my throat where I felt like something was stuck there. And to make long story short, I ended up developing an enlarged lymph node to my neck, almost as big as my fist, where I then seeked some medical attention, ended up with having to get multiple biopsies, seeing an oncologist. There were a lot of things going on in my life at that time. I was just completing my graduate degree as a family nurse practitioner. So going from being a registered nurse to an NP and then now leading to a possible cancer diagnosis was just a bit overwhelming, but that pretty much sums up all of that in a very, very short explanation and story.
And that moment, Fernando, where you received the diagnosis, can you take us back to that and if you can remember what was going through your mind?
Sure, I definitely feel as though I was in fight or flight response. So it was just, I think it is, but let me try not to be negative. Let's do the steps that are required to diagnose or make a diagnosis from my presentation. And I remember it vividly. It was the week of my graduation. Graduation was on a Thursday. Wednesday, I had my first biopsy. That following Monday, I was diagnosed with cancer. And there were just a lot of things going on in my mind at that time, from accomplishing my graduate degree as a nurse practitioner and then being diagnosed with cancer and also being an oncology nurse. So the roles did change for me overnight and tremendously, and it did affect me, but it was very quick.
And do you mind confirming for us what was the diagnosis that you received?
Sure, absolutely. So I was diagnosed with non-Hodgkin's lymphoma, stage 2.
And did that lead into immediate conversations about, hey, this is what treatment will be like, or what were those early conversations like for you?
So luckily for me, I was very fortunate for working in that specialty where I was able to obtain care pretty much immediately. I was diagnosed one like on Monday, and then the following Monday I had an oncology appointment, and then the day after my oncology appointment I already had a chemotherapy treatment. So it was very, very quick. I was very fortunate. It does make a huge difference when you work in the field, you understand the field, you understand the severity of it and the severity of the diagnosis. So it was very quick, and I got care almost immediately.
And what was that moment like of having to not only communicate with yourself and in recognizing that this is happening, but with the people in your life? How was that experience?
Very overwhelming.
Yeah.
I think that, you know, being a patient and grasping the idea and gathering your thoughts of what's going on at that moment, but also being proactive about it as well, and then having to then now share with your loved ones, right? Like my parents, my partner. I think that it was just a lot. It was very overwhelming, but I did, however, notify my family and the people that were most closest to me that I was going through, testing and
Mhm.
obtaining the biopsies needed for confirmation. So it wasn't a surprise for neither myself or my family. So that way I'm able to have that support that I needed during that time.
It's so interesting because, of course, there's the initial shock of receiving the diagnosis, right? And then the layers that that entails, preparing for treatment, but also navigating conversations. And, there's a lot that's put on your plate in terms of, hey, how am I caring for myself in this moment? And also, how do I respond to the people around me, my community, both professionally and personally? Can you talk a bit about just what it was like to balance all of that?
It was quite overwhelming, to be honest. I think that I initially started with obviously myself and kind of gearing myself and preparing myself for what may possibly come from the results and from the biopsies. And then, you know, after preparing myself, it's also preparing my closest relatives and my partner. And, with the knowledge that I do have, I was very fortunate to know how to even deliver the news, right? It's not a confirmation as of yet at that time, but the possibility was very high. So, with me knowing based on my presentation, my clinical presentation, and my signs and symptoms that were actively present, I was able to kind of self diagnose myself prior to even having a final diagnosis. So, I did prepare my family. You know, I'm not saying I do have cancer. However, these are my signs and symptoms according to this. I'm not being negative, but I wanted to prepare them for that. And then upon receiving confirmation of the diagnosis, then at that time, I had already accepted the fact that I had cancer, but I think that I was also preparing for my loved ones and ensuring them that I would be okay because I have have the knowledge and the experience of providing care to these cancer patients. So I had to prepare multiple people and
Mhm.
then sharing with my cancer team, right? My nurses and my nurse practitioners and the doctors. It was a big shock. And I also had to prepare myself mentally and emotionally to then disclose it because I wanted the most support that I can possibly have from all
Mhm.
different avenues, medically, emotionally, and in every department that I could possibly get. So I did
Mhm.
prepare. That's how I prepared for multiple people to share my diagnosis. So it was quite overwhelming.
Yeah. And that's such a unique experience, right? So I think a lot of people at that early stage of the unknown might not have that medical expertise that you have. Looking back, do you think it was beneficial that you had expertise as a medical healthcare professional at the time to kind of prepare you, or were there moments where having all that knowledge maybe made you fast forward in a way that was not necessary?
I think it was extremely beneficial.
Mhm.
So, in my past experience as a registered nurse, I worked in cardiothoracic ICU and critical care in a critical care setting. And yes, I did obtain a lot of knowledge, but it wasn't pertaining to oncology. So,
Mhm.
working in the specialty of oncology definitely gave me an advantage of understanding the process, how to go about ensuring that I find a good oncologist, ensuring that I know how to take care of myself during my chemo treatments. It was definitely a huge advantage, even knowing my signs and symptoms and what is most common with that specific diagnosis. So yeah, I thought it was beneficial. I definitely wish that I can share that wealth of knowledge amongst other people, because as a nurse, we advocate for patients. At first, it was hard for me to advocate for myself, but then I was encouraged by my peers that are nurses. It's like, hey, we always encourage to advocate for our patients. You have to advocate for yourself. So it definitely did help tremendously.
I so appreciate you sharing that because I think, we talk about identities a lot, and there are many identities we hold at once as people, right? You're a healthcare professional, you are a friend, partner, son. And then suddenly there's this identity of being a cancer patient as well. How do you think you held the intersection of healthcare identity and patient? Like, were there times where transitioning to the patient identity felt difficult, and was there a resistance to that?
Yes, absolutely, for sure. I think what was most difficult for me at that time was being the patient and not being the nurse, because most of the time I was the nurse, although I was the one sitting in the chair. So most patients would go to an infusion suite during chemotherapy and just sit there, receive their medications, either read a book, take a nap, watch a show, keep busy. Whereas for myself, I was observing what was being administered, what my rate was, how fast it's going, how slow you're going, you're checking for blood return. My clinical brain it was at 1,000 at this point, because my expectations as a nurse, I hold myself to a certain standard. So, I was able to it was difficult to kind of separate the two of being a patient and being a nurse, and it was very challenging. I think that what made it most challenging was processing my emotions. I was on fight or flight, and I wasn't able to feel the feels and allow myself to be upset, hurt, be afraid. I was just on clinical mode. So yeah, it was extremely challenging, and then eventually it caught up to me.
What did that look like when it caught up to you? What did kind of suppressing those emotions, what did that look like?
Oh man. Whew. I'm a big mush, so I get it very emotional. Um, Man, it really caught up to me. I like to say, so out of my 6 treatments, by like the fourth treatment, that's when it really hit me, where I was sitting there and I didn't want treatment, because I knew what was coming after, the aftermath, the fatigue, the pain, the nausea, the headaches. I mean, you name it, I had it. So it just became, when it really came up to the surface, it really hit me hard. Where, like you said, like you asked, what did it look like? It looked like a battered, broken Fernando Palacios that I would have never thought, because I was just on clinical mode. I was on nurse mode. So yeah, it really caught up to me. But therapy definitely helped tremendously. So thank you so much for
Goodness, it was
that.
such an honor to get to work with you in that moment. And I think, one of the things we talked about, or we're talking about today, is what are strategies that you at the time and maybe that you would recommend, to help someone in that moment, right? Where it has caught up. What were the actions you took from a self-care perspective to recognize that and help yourself?
I think one, I really think that therapy and speaking to someone other than someone who knows you was extremely beneficial, because it did provide me a different lens, a different mindset, how to process, how to think, how to navigate through those emotions and through those feelings. I think another way that I definitely cope through going and allow myself to go through that is by actually speaking up and telling people that I was not okay, which was definitely recommended, and I'm extremely thankful for it because I was very much just going with the flow and just getting it done, and that's it. But the reality is, I was bottling and internalizing all of those feelings, and I wasn't sharing those feelings with the people that I most care about or that care most about me. And I think that it did help tremendously being able to share my emotions, to share my hurt, to share my fear, to share my anger. So yeah, definitely therapy, speaking to people, writing. I wrote it in a journal and kind of to like recap my emotions and what I was feeling, whether it's, during my infusion, I felt nauseous because of X, Y, and Z, or this day I had my PET scan and, I was in the machine and I was, praying and I took a nap and then my fears were gone and, whatever it is that helped me cope during that time, because as they mentioned, and as we've discussed, like anxiety is real. So during, like, before
Mhm.
the treatment, after the treatments, like post treatment, I mean, everything is anxiety building, from even going to an infusion suite to go get your
Mhm.
treatments.
Mhm. Yeah, absolutely. I mean, there's so many triggers in those moments, right? That can lead these situational triggers that lead to anxiety, fear, sadness, anger. And what you're describing is, what does it look like to care for yourself through that process, right? There are these forces that we can't control. What do we have influence over in those moments? Um,
I think what helped me tremendously was a model that you helped implement in my thinking is, for example, my scans when I first completed my treatment. And I think that, post treatment of chemotherapy, getting that initial scan to ensure that you're cancer free is like the scariest thing to wait for, and waiting for the results and or waiting to go get the scan. And I think what helped me tremendously is to get through that fear was not fearing the unknown. It's like gather the data first, ensure you have a response or you have the information before thinking negatively, which helped me think, change my mindset and my approach when I went to go get my scans, when I was waiting for my results. It's easy for us as humans to think negatively, or not intentionally, but out of fear. And I think changing and learning ways and methods to allow yourself to change your mindset really helps tremendously when those times do arrive.
And I imagine there's a feeling of empowerment that comes up in response to this force of cancer, which is very outside our control. There are tools that make us feel more empowered in saying, "Hey, well, what does it look like for me to respond and support myself in those moments?" And you did that so effectively. Um, what was it like for you back to the talking about our support system? You mentioned communicating your emotions and telling people you're not okay, and that's something that a lot of people I think find very challenging to do with their support systems, right? It's big to be vulnerable and to disclose that. Do you mind talking a bit about what the reaction was like how did people respond when you did open up? Were there things that surprised you? Yeah, what was that like?
Oh man, that's like unpacking.
We don't have to name names.
No, 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 of course not. No, I think that, you know, for example, I don't mind sharing. I think that, as people that love other people, we always want to protect the ones closest to us. So that will either be like your partner, your siblings, your parents, right? Those are typically, most of the time, those are your closest people to you. And for myself, I think I wanted to protect my partner and I wanted to protect my parents. I'm very close to both of my parents, my mom and my dad. But the problem with that was that with loving them and protecting them, I was also affecting myself because, oh, excuse me, I get a little emotional. Um, sorry,
Okay,
sorry, give me a minute.
take your time.
Ah, so with protecting them and loving them, I internalized a lot of my feelings and what I was going through, and you know, my fears and my anxieties and the fear of the unknown, right? What I don't know, whether it's a negative scan, which is good, and I think that it was hard for me to navigate through that, and you know, when it came to protecting my loved ones, it also affected me. So I think that learning to speak to your loved ones and being open about your emotions, like, yes, you want to protect them. And of course, I think that my parents did get a hit from what I was going through, right? No one wants to see their child go through that. But eventually, through therapy and through our sessions, I was able to share with my parents that I was not okay, and that I think most people try to say like, oh, it's over, or oh, you're young, you'll get through this, and the reality is it's still something fearful that you live with, and the trauma does live on during, before, during, and after. And when a lot of also information clinically, it's like, yes, I'm done, but am I? And it's not about being negative, it's also about knowing your statistics and knowing that I would feel most at ease when I reach my 5-year anniversary of being in remission, is when I feel mentally, I would then feel better to say, okay, I could take a seat and the likelihood of reoccurrence is slim.
And just following up on that, where do you think that leaves you in terms of thinking about now and the 5 years? Like, how do you sit with the thoughts and feelings that come up in the meantime, in this period of time?
I think I've just learned to kind of just accept that, every 3 months I have to go to my oncologist, and like therapy really helped me. So it's like fearing the unknown. It's like I can't fear the unknown. I have to wait for my results, whether it's blood work or scans, and just take it from there and kind of just live by day. And that's really helped me versus, I mean, if I sit here and tell you that I don't have anxiety when I do follow up, like I'd be lying. That's just, it comes with the territory. But I really try to prepare myself for those moments beforehand, and it's like everything's going to be okay, and if it's not, we'll take care of it. It'll be okay. I think mindset really makes a huge difference for throughout it all.
And that those different entities can coexist, right? Anxiety can coexist with assuring ourselves and reminding ourselves about what we do know and what our evidence is. We know that those things can coexist in a way that feels safe and healthy for us.
Yeah.
Um, just getting back to what you were saying before, with communication, I'm curious, did communicating to loved ones make you feel closer to them after those conversations? Did it bring in a new part of your relationship?
I wouldn't say it brought me closer to them, because
Mhm,
I think that the bond I have with my family is quite special. For those that I'm extremely close to, like we're like peanut butter and jelly, or like glue. I wouldn't say I mean, to an extent maybe
mhm,
we
mhm,
might be closer, because I think that with everything that I did go through, I feel that it did bring my family closer, in the sense of also like appreciating life and appreciating memories and building memories, and
mhm.
you know So in a sense, yes and no. So
Hmm.
because we're so close, but it's
Hmm.
like now it's like an extra layer of glue that we just
Yeah.
added. Yeah.
Absolutely. That's such a good metaphor because I think it's true with people we're so close to. It's rare that we get to expose new layers, right? And I think and it can be hard to because there is such a known entity there. So I think I just commend you for your courage in bringing your community in, because people listening might be able to identify with this. There is sometimes an instinct to isolate and to say, you know what, um, something we hear a lot is I don't want to burden other people with this information, right? But really challenging those thoughts, those that internal dialogue, to recognize that there are people who do want to show up and see that other layer too.
I think that, you know, reaching out to my community was quite helpful. And then I think that it also made me closer. Like when it came to my family, not so much, but when it comes to like my friends and my colleagues and things like that, people that I call colleagues are now friends or best friends, because the amount of support that was provided to me was beyond this world, from my dance community as a former professional salsa dancer, from my dance community to my colleagues that I worked with for over 10 years. And I think that the amount of support and love I got across the board was just beyond this world. And I'm extremely fortunate and thankful for, you know.
It says a lot too about the impact you have on your community. People did show up in such a huge and passionate way speaks volumes to you and how people wanted to show up for you. So I think we tend to think about the other people, but it's important to recognize, the why too. A lot of identities we're covering here. You talked about artists, but you did mention, being a young adult and going through treatment, navigating cancer as a young adult. Can you speak to that a bit? What it's like to go through this experience at a young age.
Sure, yeah, absolutely. Wow, I think there's a lot of layers to that, because there's not just age, but also, I guess, my background and knowledge. So there's just many layers, but just to pinpoint age, I think that the stereotypical mentality and mindset of people is like, well, you caught it early, so you're good. And the reality is sometimes is not the case. I was very fortunate, but there's also many younger adults that are within my age range, younger or slightly older, that aren't as fortunate. So, I think there's a stereotype of, if you're young, you have a better prognosis. And that's not really the case. The reality is data, the information, the diagnosis, the type. I think that, knowledge goes a long way in understanding cancer. I can be, say, 22 and be diagnosed with stage 4, or I could be 22 and be diagnosed with stage 1. So understanding the differences and having that knowledge really makes a difference, because there is that mindset that when you're younger, it's a better prognosis, and that's not always the case. And I think another identity that I also another issue I encountered due to my identity of being a young adult is not being heard by providers, you know, um, from understanding blood work and, questioning, say, an abnormal lab value and bringing it to a provider's attention, and then being told, and then addressing like my chest pain and then my itchy skin and feeling something stuck in my throat. It's like, oh, you look fine, your numbers look good, everything's okay with you. You're young, you're a hypochondriac, everything's okay with
Mm.
you. And to be honest, because of my age, I felt as though I was very much ignored. There was never that extra digging and that extra investigation that was implemented to try to investigate why I had abnormal chest pain from nowhere. There was, and that's where I played the role of a patient. As a patient, I'm like, okay, a chest X-ray should be suffice. But the reality is, no, it wasn't. I needed like an MRI or CAT scan in order to kind of get answers, and the answers that I didn't get. So, because of my presentation, because I am young, so I think that a lot of young adults, and I also see it amongst like teenagers and children when they address things now, they kind of get ignored because they're young, and it's a common struggle.
Mhm. Yeah, that's a huge, huge point you just made. And I think, there are a range of biases that people encounter in all settings in life, including healthcare facilities and medical establishments. And I think you're pointing a really important one, which is this idea of age and preconceived notions that providers might be bringing to each interaction. Was there anything that you did from an advocacy standpoint that you felt like was effective, or how did you try to navigate that?
Yes, I did actually. I think that, again, knowing your resources and having available resources, I was able to navigate through that,
Mhm.
from getting the testing I needed that, say a certain physician didn't want to order, and I had to go through different avenues to kind of get the answers that I wanted. I think time is of the essence, and if we suspect a cancer diagnosis, then for me, my mentality as a provider, because I am a provider as well, although I don't practice as one, is to gather all the data and all the information you need to be proactive and get the ball rolling to get
Mhm.
treatment if that were the case or the suspicion. And I felt as though it was, ageism does exist, and
Mhm.
like, oh, you're young, oh, you're fine, oh, it's a lump on your neck, you're gonna be okay. But the reality is, time is also essential and very important. So, you know, I was able to navigate through that and go through different avenues to kind of get the answers I needed, and it was very helpful. But again, I'm very extremely fortunate, but not many people have that ability to do that.
Is there advice that you think you could share with patients who are encountering those types of barriers?
I think the most important is kind of what I've learned for myself is learning to find a provider that actually listens, that actually cares. And it's hard. And the reality is that there's an extreme burden in obtaining care, right? We have a lot of sick people, and, but I think it's almost like shopping around. I always recommend people shop around until you feel like the clothes fits, right? And it's the same thing. It's like you shop around for your physician until you feel heard, and that's pretty much like the best advice I could give someone. It's like, if you don't feel heard, go to the next. If you don't feel heard, go to the next, because it will take that just one person to make a difference.
Mhm. It's really important advice because I think the other thing to acknowledge is there is a power dynamic that happens between patient and provider, right? And sometimes we hear that patients feel, "Oh, I wanted to ask this or say this, but they only had 5 minutes or they were rushed." And, I think what you're pointing out is really important, which is as the patient, you are also a client, right? It is a service that you are being provided, right? That they are providing for you. Sometimes it's flipped where we think, oh, I need to behave a certain way for my doctor. I want to be a quote unquote good patient, right? Um, but I think what you're suggesting is challenging those preconceived notions and finding what's right for you.
No, absolutely. I think, as a patient and across the board, all patients have the right to voice their concerns and to advocate for themselves, for their loved ones. I think that it's so, so important. And you need to find a provider that you feel most comfortable with, where you feel heard, where you feel like you're getting answers. And, you know, I think it's so important. I think that, We need people to really not be afraid to ask questions and to bring up concerns, because it could be the smallest thing. It could be itchy skin, and who knew that itchy skin would be a sign and symptom of a possible, cancer diagnosis, right? So it could be the smallest thing that would could make the biggest difference, right? So I think just finding that one person to hear you out to really make a difference in your life.
Is there a piece of advice or guidance that you would share with our healthcare professionals who are listening? We've talked about the patient experience, what they can do. How about for the nurses, pharmacists, doctors, social workers, etc.? What message would you have for them as someone who has this overlap in identities?
Utilizing your resources. Don't be afraid to ask for help. We know the system. Be the patient, but also be the provider, be the nurse, be the social worker, be the doctor, but also be the patient. I think that's also extremely important. But definitely utilize your resources to the best of your ability, because I think we need to be there for each other. And I think that most of the time, we want to be discreet. We don't want to be a bother, or we feel like we may be a bother to our colleagues and our peers and to the organization. And don't be afraid to share your story, because you never know who else is going through it, or who else lived it. Being able to share my story as a provider, I actually see a lot of people in the medical field, from nurse practitioners to administrative assistants to, nurses and doctors that went through it as well. And, you're not alone. So I think that that's definitely a takeaway from it.
It's a good transition to ask, how do you think it's impacted your work today, right? You're working full time. Can you talk about how you see this experience as showing up in your interactions with both patients, but also your colleagues and the influence that's had?
Sure. I mean, since my diagnosis, my role has changed. I have had the ability to now move up in nursing leadership, and I've been in nursing leadership for about a year now. And the roles have changed from going from bedside care or chairside care to now leading my team. And I think that my experience definitely helped me in understanding what the patients actually go through, right? Whether it be emotionally, physically, even financially, because there is, survivorship burden in oncology. So I'm able to think and understand, I guess, the care that's provided to the patients at a different level, be empathetic at a different level, understand these patients, their frustrations. And I think I'm able to now share my experience with my nurses and my team to provide the best care possible for our patients, to be a little understanding and be more empathetic, right? Because the reality is, as providers, as much as we love our jobs, it's also a job. It's it's how we, get our pay. We pay our bills. We get the food on the table. We get to live. So the reality is that we tend to forget, as providers and caretakers and nurses and staff, that our population, right? Our population's oncology. So we have to be mindful and understanding that yes, it's a job, but what our patients are going through is traumatic and it's life changing. So I am very fortunate and very blessed to be able to share my experience with my peers and my nurses to try to provide the best care possible for the rest of the community.
I also wonder for yourself, has it felt like a gift for you too to kind of bring them in and receive that support that maybe others wouldn't if they didn't bring them in that way?
Yeah, no, for sure. You know, so yes, I'm in management and I'm very hands off, but I'm also hands on when I need to be. But I do go and, make rounds and speak to the patients, and it's like when you know, and when you know, right? So the moment I see them, I'm like, "Hey, good morning." And you can just tell I'm very big on energy,
Hmm.
and I'm like, "Hey, do you just," and it's just from the good morning, from the hello, just based on delivery. I'm like, "Hey, do you mind if I join you for a little bit? Do you want to
Hmm.
chat?" And my chat goes a really long way. I'm able to share resources that I was able to utilize, whether it be finance, whether it be therapy, whether it be food, whatever the case may be. I'm able to now share with the patients when I go and I sit in their room. Or I'm able to tell them that it's okay not to be okay, and I think that most of the time they want to be okay, or they think they have to be okay because they don't want their family to see them, distraught or upset or sad or angry or afraid. But I always remind all of my patients that it's okay not to be okay. And it's okay to feel the feels, is my favorite line. It's okay. And I always say, it's just give yourself grace, allow yourself to feel your feels.
And what a powerful way for your identities as both patient and healthcare professional to merge in a way, right? It feels like they're linked while separate. There's a linkage in them that makes you clearly an extremely compassionate and effective and empathetic provider. But also, I think it sounds like from your own patient experience, it impacts how you operate when you do go in for your own tests too.
Yeah.
Just getting back to you for a minute, we talked about when you started treatment. Can you talk a bit about what it was like ultimately to have your final treatment?
Wow. It's so hard to say. It was very overwhelming to, I mean, go to treatment day by day. I mean, several weeks at a time, right? I think that I had to prepare myself. Uh, you know, the anxiety of knowing that I had 6 treatments from now having 4 treatments left to then having 2 treatments left. And the closer I got to the end, the more anxiety building it was. Because at that point, my mind is like, okay, I'm done. I can't anymore. But then that other side of the mind is like, no, you can, you will, and you can, but you will. Even if you can't, but you will. So it was extremely overwhelming to go through that and have those moments, where I may have woken up in the morning and just looked in the mirror and just kind of let it out and let you know let it loose and just cry my eyes out, right? That's what it was. And then there were times where even driving to therapy, to treatment, it was overwhelming. Or
Mhm.
even now when I drive through those areas, it's like PTSD. It's like, oh, I don't want to. I don't want to be around there. But it is very anxiety building, and everyone goes through it and processes differently. And what I was able to take away from that is the ability to try to change my mindset when being closer to the end, right? Like I'm almost there. Yes, it's been hard. Yes, it will be hard. But knowing that it will be over was what gave me the power to continue going forward. But there were different stages. There were stages of happiness, right? As weird as it sounds, like seeing some of the nurses or some of the techs at the infusion center and building a rapport with them and giving them hugs and bringing them treats.
Mhm.
To there's days like I wanted to see them, but I didn't want to see them because it was a reminder that I had to come for treatment. I there were just there were stages of happiness, there were stages of anger, fear. So yeah, it varied.
Mhm. It's such a, I think, very informative reflection because there are people listening who probably can identify with the different stages and that it's not linear, right? And we've talked about that. we might have a predominant emotion one day, and then suddenly it's something completely different the next, right? And just recognizing and moving through that, right? Knowing that that's okay. The self acceptance piece of that.
Yeah, for sure. And it's unpredictable, you know. Some days, and I'm able to share that with my patients now. I think I think my takeaway from all of this as a caretaker, provider, as a nurse is, I guess the worst question to ask is how are you doing? And it may sound weird, it may sound funny, but when we come and we arrive to our appointments, it's like, "Hi, good morning. How are you? How are you doing?" And you know, I try not to do it even for myself, and it's very hard because it's out of custom, right? We're used to saying, "Good morning, how are you? How are you? How are you doing?" But what I try to do now is, "How are you feeling today?"
Mm-hmm.
versus "How are you doing?" Because the reality is, I have a lot. I have a lot to tell you when you're asking me, "How are you doing?"
Yeah.
I had a patient today where I was like, "How are you feeling today?" And she's like, "I'm so glad you didn't ask me how are you or how are you doing because I'm not okay." So I'm very mindful and I try to really put that out there where it's hard to ask someone who's going through treatment, who's lost their hair, where their appearances have changed, their uh, physical appearance or their emotional being or their mental being. And I mean, so many things change during that time. So I think we just, being able to share that also.
Yeah. Do you think that that extends to people who are supporting friends and family?
Yeah, I think that's definitely a good takeaway for everyone. If you're unsure of how to speak or ask someone who's going through treatment, whether it's chemo or radiation, surgery, is how are you feeling today versus how are you? How are you is such a broad question, and I feel
Big
like
question.
it's a big question.
Yeah.
Uh,
That's great advice for everybody.
yeah.
Are there other reflections or advice that you would want our viewers to know, either from the patient side, caregiver family side, or professional side?
Yes, there's so much. There's so much to give. There's so much to take away. There's so much knowledge, and I think most of all is not being afraid to advocate for yourself, not being afraid to ask questions, not being afraid to share your story and share your experience and acknowledge your feelings. I think that when, especially as a provider, the tables have turned, it's very hard to put yourself in that chair. And I think that for people that are either going through it or not, or, because the reality is families and loved ones do still suffer with you, it's just being mindful as caretakers, providers, healthcare professionals, to be mindful that of how we kind of deliver our messages, speak to people, body language, tone. I mean, there's just so many things and so many like advice and tips and pointers that I can definitely provide. But I think those are definitely on my top tier. And uh, another thing I definitely want people to take away is don't be afraid to reach out. I think that my biggest wish is that the people I wanted to reach out to me during the most vulnerable time of my life weren't there. And the reality is, because that time is so traumatic and it scars you and you live with it, your mind is very powerful and you think about the times of, or you think about who was there and who was not. So, for those that don't know how to communicate or how to share their emotions, it just takes a phone call, a text, a FaceTime to just say, "I'm thinking of you." If you don't know how to share how you're feeling, or you can't see that person, or you don't know how to express yourself, I think the most important thing is to just let them know that you love them and you're thinking about them, because it goes a long way. Because as much support as I had, despite all the love and support I had, there were times of loneliness. There were times where I felt the most lonely. So I think just sharing that can definitely help your loved ones, and or even reaching out, just saying hello, like as a patient, like someone who has a cancer diagnosis, just reaching out to those that you're thinking about. Also, you know, uh, which was mentioned in therapy. It's like, well, do you think you should reach out to them?
Yeah.
And it did help, because sometimes people just didn't know how to like cope.
Mhm. And I so appreciate that message to our caregiver listeners, because sometimes there is a societal or cultural discomfort with speaking about illness, with speaking about, we hear that word cancer and people kind of don't know how to respond, right? They freeze. And what you're pointing to is there are actions you can take to unfreeze as a caregiver or a friend, right? Even if it feels overwhelming, thinking about what it must be like for your loved one, and even sending a text expressing that, right? You don't need to have all the answers for them, but even just showing up through that emotional outreach goes a long way.
It does. It goes a long way. I mean, there were times where I've gotten text messages like, I don't know what to say, and it's okay. You don't have to know what to say. But the fact that you messaged me and you thought about me and you just told me you love me and I'm here gave me some sort of peace, and it gave
Yeah.
me that warmth that I needed.
Right. And I think there's sometimes a misconception of, oh, well, if I check in, am I making the person think about it more? They're thinking about it, right? They're thinking about it. You bringing up and checking in about how someone's treatment is going, it's not that they're not thinking about the fact that they're preparing for another infusion, right? So the question is, how can you show up and be there, and in what ways?
Yeah, for
So
sure.
that's that's great. And in terms of seeking support from a counseling perspective, do you have advice for people who are thinking about, hey, I think I could use emotional support. I don't know what counseling would be like. Can you kind of talk a little bit about that?
I think that there's a huge stigma when it comes to mental health and to counseling and therapy and psychologists versus psychiatrists, and overall just mental health. I think that despite it being a common topic, I think that there are still some stigma towards mental health. And I think that it's so important to share and speak to someone that you don't know, where you feel like you're not being judged, where you have the ability to, if you feel comfortable with your therapist, to put that wall down and allow yourself to feel your emotions. And I was able to do that during my sessions, where I had this wall. I had a clinician. I had the mentality of a clinician. I had mentality of a son, of a partner, of a boss, and I'm good and I'm ready and I'm doing it. And it was just go, go, go. And therapy allowed me to bring down that wall, because it was a really, really strong brick wall. And sometimes it's okay to knock it down, to allow
Mhm.
yourself to feel how you're feeling. And therapy really helped me a lot, more than I could ever accept, or thought that I could, or I would have ever thought that therapy would help me just to that extent.
Well, thank you for sharing that. It's really the greatest gift to get to be part of the journey of seeing you take down that wall, right? Because in the process, seeing what skills you develop for yourself, and it's hard work, right? It's not easy. Signing on for those sessions, it's there's a lot of courage that goes into it. But as the wall comes down, I imagine, you recognize and see everything else that comes with it, right? That you are able to fit in.
Yeah, and absolutely.
Um,
I mean, it does help. And even after therapy, after you complete your sessions with like I've done with you guys, I think that the reality is you live with this trauma, and it there's days that you may have it trickling up again, up that drain or up that tube, and it hits the surface, and it may not be all the time. It may be once every 2, 3 months where I may have that one moment where, holy cow, I can't believe I went through that. Like, it's wild. Or anniversaries, or like birthdays, your first birthday cancer free, that it's within itself was so overwhelming for me this year. I'm wearing green because of the lymphoma color. I mean, there's just little details that really make a huge difference, like post, like during your treatment, post diagnosis, post treatment, and it just kind of lives with you. And therapy really has helped me kind of ground myself. And it's those moments like your birthday, or like an anniversary. It's like, oh wow, like this day last year I was diagnosed. That's an anniversary, as weird as it sounds. It's like, I can't believe it's already been a year since I was diagnosed. And then
Yeah.
this is my first cancer free birthday after my cancer diagnosis. Like, it just hits differently, so it kind of lives on, but you just learn to get through them.
Yeah, and the tool, we always say, even if the sessions end, the tools and the conversations last, right? That you're always able to tap back into that, and it helps with navigating all these milestones that you talk about. So
And
thank
it's
you.
okay. It's okay to feel how you feel. It's okay to be sad, right? It's okay to feel that, when you look back at your pictures last year when it was your birthday, to be hairless, where I had no hair, no eyebrows, no mustache, no beard, and this year here I am, and I have all of it. And it may sound silly, but it's a huge milestone. So it's expected for people to feel a certain way during that time, and I'd like to share that, because I think that most people try to say, oh well, that's behind you now. It's like, no, it's really not. It lives in me forever. It's just I've learned to live with it and move on and get through my day, and but it lives with you forever. It's just learning how to accept it, and
Right.
how to acknowledge it, acknowledge your emotions, and learn to, you know, get through it. So,
I think there's a saying, right? You move on from something. And I think when it comes to cancer, you can't move on from it, right? You move with it, right? What does it mean to move with this traumatic experience, knowing that there will be moments where you can fit more meaning in your life and moments and days that are harder than others, but what does it look like to continue with it? And you just very so eloquently shared great strategies for how to do that. So I'm so grateful to you for sharing your story. I'm grateful that I wore a shade of green. I think this counts, kind of
it
turquoise
does, it
maybe.
does, it does.
Yeah. And I just thank you for your time and for all the wonderful insight you gave our listeners.
Of course, thank you for having me. It was an absolute pleasure to be here today.
Well, thanks again, Fernando, and to everyone listening.
Yes, thank you, everyone.
Thanks for tuning in to Cancer Out Loud, the Cancer Care podcast. Cancer Care is the leading national nonprofit organization providing free professional support services, including resource navigation, cancer-focused counseling, support groups, educational resources, and financial assistance to anyone affected by cancer. You can visit us online at cancercare.org or call our toll-free Hope line at 800-813-HOPE. That's 800-813-4673 to speak with a master's prepared oncology social worker.